fitness industry is really big in terms of globally. It's a multi-billion dollar industry. When you look at a senior population, 1 in 2 seniors over 80 years of age suffer a fall each year. Even at a later age of life, you can start and you can begin to gain functional capacity. So you can be a global health specialist that cares deeply about climate. You have to start with one thing. Your first step is the most important step.
Namaskar, this is the Professor MVP podcast. I'm Mahesh Panchagmula. This is your resource to make informed career decisions. This podcast is brought to you by the IITM Global Initiative of the Office of Global Engagement at IIT Madras. IITM Global is a platform to take Indian enterprise and thinking global. You can learn more about the recent activities of IITM Global in the link in the description. We have a delightful conversation ahead today. We're going to talk about kinesiology, elder care, and the whole idea of aging and movement. Our guest today is Professor Shanthi Johnson, professor at the University of Windsor and Vice President for Research and Innovation. Welcome, Shanthi. It's a delight to have you here on this podcast. You started in a very different field from where you are now. You started out studying nutrition and you found your way to understanding elder care. Can you help us understand that transition and also your motivation?
Thank you, sir. Happy to do that. First of all, let me say thank you for creating a resource like this to benefit our future generation, to make informed choices. I had a very meaningful journey so far in my career. Growing up, I was very much into athletics. I loved sports, I played basketball, and so I was very much drawn into sports nutrition. How do we enhance performance? What kind of food will give you that edge that we need? So I pursued education and nutrition. And after that, I began to think about the influences of groups. And so building on that nutrition background, I was then able to pursue a PhD in kinesiology that looked at group dynamics and how we operate. And that platform led to another opportunity of a postdoctoral fellowship at a center called Canadian Center for Activity and Aging that allowed me to combine my background, education in nutrition and exercise sciences to provide application for seniors' health and well-being. So I've been very, very fortunate to create my own path of a learning journey so far to an area that is really important and meaningful for our society, not just in Canada, but globally.
Yes. I think there are estimates that elder care today globally is between $1.5 trillion to a $2 trillion business. Right here in India, the estimates are between $7 to $10 billion and growing. Of course, today we are a young country, but the day when the country ages is not too far away. We have to start understanding the science of aging, the science of movement. Let's start with your own understanding of kinesiology. You worked in this space for some time. Our audience are primarily discerning high school and college-going students. Help them understand kinesiology as a discipline, please.
Wonderful. Happy to do that. Kinesiology is a relatively new field, but at the same time, it's got a long, illustrious history, as in any field of study. So defining kinesiology is a study of body movement. It allows researchers and students to study from a molecular, how a cell interacts with another cell, and understanding how our body functions, all the way to health management, policy influences, and how that broader framing of society operates. So it is a very broad field with application not just in healthcare, but in corporate world, in long-term care sector, and many, many domains as well. So very versatile degree that spans from natural sciences and humanities. For example, I'll give you biomechanics is a subfield of Kinesiology, which studies about efficiencies of body movement. So it's got more in relationship with science and engineering as opposed to some other field. So these fields are very intricately connected and very applicable to our society now.
Wonderful. I think we'll come to sports a little later. But keeping on the topic of body movement and biomechanics broadly, what are some cool discoveries that have happened in the last decade or so out of your lab and out of the peer groups that you interact with? Help us understand, some ideas that have emerged that are today changing the way we look at movement.
Absolutely. Some of the coolest are also some of the simplest. So I always talk about in my own work, we look at exercise interventions to improve functional capacity and reduce falls in seniors. When you look at a senior population, 1 in 2 seniors over 80 years of age suffer a fall each year. And 1 in 3 over 65 years of age. So it is an issue that affects a broad spectrum of seniors. So what my research team has done is developed home-based exercise program that people can do in their own home to support their own living, independent living. That's the wish of most seniors. As they grow older, they want to live independently to the extent possible. So the coolest finding, I would say, is that our body is very resilient. Even at a later age of life, you can start and you can begin to gain functional capacity.
When you say functional capacity, I want to make sure our audience understands. Help us define it in a way that we can wrap our minds around it.
Absolutely. Functional capacity in the simplest term is just getting up from a chair and walking from room to room. For a young athletic person, that doesn't take any thought. But for a senior who has compromised function, that's a hard task to pursue. So the exercise program allows them to the basic capacity to get out of a chair, go from room to room, look after their own health and well-being to the extent possible. So the coolest finding is that you can do that at any age. We've had participants over 90 years who have been able to improve their functional capacity so they can go out of their house to enjoy a picnic and a party with their family. So it's a very meaningful way of addressing function and enhancing health.
Very interesting. If someone wants to become a kinesiologist, one of our young audience that's watching this podcast, where do they start? But before the idea of where we start, help us understand some careers that are already here or that you see sort of on the horizon in a decade or so from now.
Fantastic. Career pathway is important. Everybody gets an education to make a meaningful contribution, whichever sector they choose. So let me start with research and academic sector. And so that is a pathway I have chosen. I did my undergraduate degree, my master's, and a PhD and a postdoctoral fellowship to be able to pursue research, which is an honor of my life. You can also choose healthcare-related industry. You can work with long-term care or hospital in terms of providing holistic rehabilitation when a person has some form of injury or a health condition. So healthcare impact is really important. Fitness industry is really big in terms of globally. It's a multi-billion dollar industry. Again, those could be one-on-one as fitness trainers, or it could be corporate fitness professionals. So those are some expanded capacities. But more meaningfully, if it's in seniors' health, it could be in the continuing care sector or long-term care as an activity specialist. It can also be in the government sector in terms of influencing policy, because we do need strong, sustainable, healthy policies that govern various systems and sectors of our society. So again, many incredible civil servants, politicians have kinesiology background, and that's again a career pathway of choice of some.
You've made a career transition, like we discussed, from nutrition in a way. What inspired you to spend the last decade plus of your life focusing on aging and injury in particular? You have published quite widely on falls in seniors. In my own immediate and extended family, I know of such incidents. Help us understand your own inspiration to go in that direction.
Fantastic. When I started my career, I was working with athletes. I was using nutrition and exercise modalities to make them run faster, jump higher. And then a bit of a switch happened in my own heart, in my own philosophy. It wasn't as important anymore for getting athletes to run faster. And I reflected on if I use the same modality to enable a senior to be able to be independent even in their own home, it gave me a lot more satisfaction and it was a lot more meaningful for me. So it was sort of a philosophical shift in the approach to research. Pursuing bold and meaningful research has been very important to me, and this is an incredibly important way to give back to society. And we reduce falls, we reduce the consequences of falls, not only in terms of hospitalization, but also people develop a fear of falling and become cocooned in their own homes and not enjoy gatherings, not enjoy family events. So it allows for that life to be lived to the extent possible. So it's a really meaningful work for me.
The number you threw out just a minute ago, 1 in 3 seniors above the age of 65 would have experienced a fall or would experience a fall. That's startling. What are the biomechanical or the physiological reasons for this? I mean, why does this happen so much?
So falls is multi-sectoral, multi-dimensional, so it's not always one thing that causes. But there's been tons of research to understand what are some of the risk factors that predispose somebody to fall. And when they've looked at some of the predisposing factors, number one is your functional capacity. So do you have sufficient balance? Are you're strong in terms of your muscle strength? Those are one arc. Environment has been known to be a risk factor. Is the lighting in your house sufficient to be able to see clearly where you're taking your foot? Or is there a loose rug on the floor that's going to trip off your feet? And so again, looking at those kinds of dimension is important. Vision, right? Some people don't get their eyes checked, and that's incredibly important. So if you're not having a appropriate level of vision with your glasses, those are easier things to do. So in my own research program, I have 2 arcs. One is epidemiology of falls. That's a big word to say. I study the trends and patterns of what causes a fall. And then the second is when I understand and know what causes a fall, I intervene and I provide intervention research. Then that reduces the incidence of falls. And I work with the system, so in long-term care setting or home care, where services that are delivered to the seniors' home in Canada. So I use system-integrated, policy-relevant research in this area.
And we come back to functional capacity again in trying to understand falls. So functional capacity, as you said, can be enhanced even while you're quite advanced in your age. But what I'm picking up is it is best to start young. Keep your functional capacity intact and be agile. What is a good way to test whether I am, doing a good job at it? I'm 53. How do I know whether I'm okay for an older Mahesh?
So there's a number of ways. There's fitness assessment that is done, very much like we would do nutrition assessment or assessing the functionality of an equipment, for example. So there's a battery of tests your personal trainer can assist you with and give you scores that then give you what is your functional capacity. But sometimes in my research, I can't bring seniors to a gym. So I do very simple tests in the people's home. For example, one test I really like is called functional fitness test or functional mobility. It's a 3-minute walk test, 3 meter. So people get up from the chair, walk 3 meters, come back and sit down. The amount of time that's taken is calculated. So we do the assessment pre and post intervention to see if we have made a difference in terms of the functional capacity.
Wonderful. So what I am picking up is, of course, there are careers to be built. But this is knowledge that we can begin to apply to oneself. And from your own research, and you've been at this for at least a couple of decades in the public space, share some rewarding moments in terms of stories that that have changed the way you've looked at your own research?
Absolutely. I cannot agree enough that you need to start early. Prevention is better than cure. We've all heard that, and so that is so true to our capacities. The longer that we can maintain, the better it is. And starting early is important, but it's never too late to start. So even within those premises, I think it's important for us to think about functional capacity as being part of our everyday life. It's not something that you'd go to a gym to do. It could be home-based exercise you could pursue. It could be in group setting. In one particular study, we also found seniors were isolated. And so we combined exercise and social isolation as a combined modality in terms of addressing the whole total well-being of seniors. So those are some additional opportunities for seniors' health.
We'll come back to this, and particularly in the context of maybe athletes also. But your research has been highly interdisciplinary. You started, in one direction, and you've continued to maintain a sort of an interdisciplinary mix of fields. A young student trying to sort of engineer their career, today's youngsters have many interests on their plate. What advice would you give them in terms of trying to combine different disciplines or trying to blend knowledge from other disciplines, even at the start of their career? Is it a good idea, or is it a good idea to just become good at one thing first?
You have to start with one thing. Your first step is the most important step. And so for youth, I would encourage them to think about what they're interested in, what their strengths are, and start from the position of strength. And eventually build towards that interdisciplinarity through many opportunities. There's lots of opportunity to bring interdisciplinarity. For example, there's a lot of lecture series that students can attend. There's podcasts like this that is available to gain new knowledge, and then experiment. I had lots of opportunities. I was privileged. So I was able to take that really strong, robust building blocks, deep-rooted knowledge, to applying in different contexts. That can be done through experiential learning, for example. Now in undergraduate, they have student mobility, student exchange kind of opportunity. Even in my own University of Windsor, we have student mobility programs. Those are incredibly important opportunities to test waters, if you will, to see if that is sort of the pathway that you want to forge. And with the modern day privileges, you can engineer your way into the passionate area that you want. It's not always a straight line. We often think about you take step 1, step 2, and step 3 and into a career. And these days, students have multiple careers and pathways and interests. And so that's one encouragement that I want to provide. Start strong, but build forward in a way that matters. The second would be you need to be also focused. My research was started with athletes, but it's focused on seniors' health for 20 years. So you can make a deeper impact in one particular field.
I think today's world, as you said, offers sufficient opportunities along the way. The national education policy emphasizes, internships outside your own area of expertise or study. It emphasizes taking elective courses, a breadth of elective courses. And these are all opportunities that students in India can sort of embrace and go in directions that they think are rewarding to themselves. I will broaden your discipline and call it more public health. So if a student wants to go into a public health related discipline, what skills or qualities do you think that person should have? I mean, if I want to go in there, what do you think I should be looking at within myself?
Yes, yeah. Very much like kinesiology, public health is a very broad field. You can be very narrow in terms of wastewater surveillance, for example, to look at pathogens. So that's one group. You can also do big stroke policy influences that impacts the population's health. But the starting point is your commitment to the population's health. That might be your ground truth in terms of where you want to make an impact. And then there's a number of lanes, if you will, that you can pursue. When I was the dean for the School of Public Health at the University of Alberta, we had environmental health as a specialization, we had biostatistics and epidemiology as a specialization, we had health promotion as a specialization, and you can also find a way, and global health. You can also find ways to intervene. So you can be a global health specialist that cares deeply about climate and environment.
This is it's a fascinating direction for this conversation. Public health. Where do you see as the next generation careers for public health professionals? Are governments largely still interested? Are governments largely the employers, or are there private sector employers that want to do work in public health as well?
Mm-hmm. There's huge opportunity for both public sector and private sector. When you think about COVID, for example, there was a whole lot of role that private sector, pharmaceutical industries, vaccine producers had a big role in public health. So that might be one angle. And oftentimes when we think about public health, we think about immunizations, but that's not public health. That's one sliver of public health. But it's the whole continuum that makes and keeps a population healthy, which includes the systems and structures we have. For example, in India, we have a robust and one of the largest public health network called primary health care. So utilizing those kinds of network and supporting and positioning them for success is really important. So we need capacities as one. So you have a really strong education program, you have infrastructure that leverages, and then policy and governance and leadership. So you need all three elements for the public health to survive and thrive.
So what I'm hearing you say is the set of professionals in a public health system are, the patient-facing people, doctors and nurses, is only one small part of the larger system.
That's right.
What are the other professions that are sort of around in this ecosystem, especially ones that build on tech and engineering?
Right, absolutely. The big data has come in a big way, and AI, those are really important interfaces for even data analytics to inform policy change, practice change. Those are important pieces. Technological innovation. Wastewater surveillance wasn't as big. So again, huge opportunity for environmental engineers to be in that space. And so it sort of brings in domains that are not traditionally thought about as public health. And so this people with environmental engineering specialization, for example, can pivot their research interest into public health or health outcomes. So that is one example of how that positionality can be leveraged. But it can't have to do it alone. There's a number of people who are pursuing that kind of work, and looking and reading about that, getting to know about the work would help understand and carve your own pathway.
So for students, we talked of different career options. We talked of research. We talked of healthcare, fitness, and the policy-facing government sector as well. For students who sort of are unsure, what would you advise them in terms of what sort of mindset is needed to go into research, what sort of mindset is needed to go into the other two or three?
Mm-hmm. One common mindset that's needed for any direction is commitment. Correct. Right? Passion in terms of you want to be the best student possible in terms of engaging with the material that is given. And so being a good student is absolutely important.
Sure, you heard that.
And leveraging those opportunities to see what is out there in terms of stepping out of your comfort zone. And you talked about exchange opportunities. Those are opportunities that can be leveraged and utilized for testing waters. I will also say in looking at resources that are available online, there's free online courses from credible international universities that students can take for free.
Yeah. We will have a listing of all of those courses at the end of this podcast for students to know where the starting points are. I think, back to your own research career, you've been an academic, and you've also taken on leadership roles in a university administration. what would be, ideas that university leadership globally should be taking on to be able to help students do more with their time, especially on innovation? What are some ideas that that you've sort of brought to the table globally or within the University of Windsor that would help students be more innovative, be more research active?
Right.
In some sense.
Definitely. So University of Windsor has been a leader. We have opportunities for undergraduate students. There is a fantastic program called Outstanding Scholars. And so these are first-year undergraduate students that get to spend time in professor's lab, working alongside their PhD students to learn about techniques, and that then can spur their interest, spur their curiosity. As they mature into their undergraduate program, they can pursue honors degree, for example, and pursue a small undergraduate project. And that can provide pathway for graduate work. There's a number of interdisciplinary programs at the University of Windsor. We have faculties that are really strong in many different disciplines, but traditionally we have strength in automotive. For example, Windsor is known as the automotive capital of Canada. So again, from undergraduate to research associate, it provides that whole span. We sit right on the Great Lakes, and water is shared water resource between Canada and the US. And again, environment is an amazing area. And we have a research center called GLEAR, Great Lakes Institute for Environmental Research, that's pursuing amazing research. We have greenhouses close to the university, so that's an emerging area of ag tech. Innovation that's happening. And again, from undergrad to more senior research students are participating. So those are some examples of opportunities. And students do need to be bold and create some pathways. Go speak to your professors if that is of interest to make those connections.
I think it's important to start early here, isn't it? When you are an undergrad student or possibly even in high school. Take on a small project that is not part of your normal curriculum, but do something more with, in the intellectually challenging paths.
Exactly.
Let's come to your own research. I mean, you worked on kinesiology for a while now, musculoskeletal health. Tell us a little bit about the interface between good nutrition and good musculoskeletal health, which could probably prevent falls. Help us understand that, please.
Wonderful. It's nutrition and exercise are two sides of a coin. You can do all of the exercise you want, but if you don't provide the fuel that your body needs, you're not going to be an efficient machine, for example, efficient system. So in one project, we combine the two modalities. We combine nutrition supplementation along with home-based exercise program. And what we found was the combination intervention was much more efficient in increasing mobility, strength, balance, perceived well-being among seniors. Exercise alone was the second in the list. It is a very powerful modality. Nutrition alone was not as strong as a standalone mobility, but the magic happens in the combination.
Wonderful. I think you have also worked on the differences between urban and rural elder care, rural elder behavior. India is still, nearly 56% rural. Help us understand at the qualitative level, what are the differences between elder care in these two contexts?
So the rural and urban are quite different world over. When we see research and intervention, most of the work is urban-centric. The university is located at the urban center. The research institute is located at the urban center. So the rural provides a lack of infrastructure in some ways, if you will, and seniors who live in rural communities are a lot more isolated. So we have been able to utilize the home care network that services both urban and rural seniors to deliver the exercise program. And so where there's service limitation in a rural area, using existing pathways have been incredibly important. The second big difference we find in rural, the sense of community. people helping each other. They do know each other in rural communities, and people were giving each other rides to the senior center to do the exercise. So the sense of community and well-being of them coming together is stronger. I find in the metro and busy city lives, the social connectedness sometimes is getting lost. And so those are some examples of difference you would see. And given there was a lack of research in the rural context, we looked at epidemiology falls in urban and rural centers. And what we found was seniors in rural communities fell more. Their injuries were much more catastrophic, more serious injury.
And it may also have to do with the environmental aspect that you described, that the urban and the rural environments are somewhat different. I want to also talk a little bit about degenerative disorders. They seem to have almost a incapacitating effect on the elders, be it dementia, Alzheimer's, Parkinson's. What are things we can do to sort of help our elders navigate those phases? And how do we understand that?
In the last 20 years, there's been quite a bit of research in the degenerative disease field, as you've explained a few examples there. And these are challenging conditions, and the research and evidence is evolving. And from the background of exercise sciences, what it shows is that even at the different stages of disease progression, exercise can be beneficial. So, for example, at the London Health Sciences Centre, they had a Parkinson's exercise program long time ago. So these are exercise programs that brought together patients with Parkinson's to provide customized level-appropriate exercise program that was supportive of enhancing sort of muscular flexibility, enhancing strength, and so on. I'm really encouraged with the science that we see. For example, in dementia. In the past, we thought you were born with a certain set of neurons, and when you lost them, you lost them. But modern research shows that the nerve cells neurons connect each other, as even through the disease progression, through medication, for example, exercise, novel tasks, trying something new has been shown to create neuroplasticity. And so enhancing the connectivity between neurons as people age. So there's a lot of promising research that's coming out of fields of regenerative medicine.
And as young men and women in our, let's say, middle age, how do we ensure we are preserving this neuroplasticity? What can we do to make sure we remain neuroplastic at an advanced stage?
Mm-hmm. So education is a great thing. They have shown, there have been studies. There's a nun study. It's one of the oldest studies where a group of nuns who sort of kept record of their day-to-day life, who read more actively, had much more neuropreservation as they got older. So reading and engaging in new material is good. Physical, functional exercise and other practices are important. Not smoking, those kinds of unhealthy practices or minimizing them has been shown to be effective. Furthermore, the environment also has a huge role to play. And so there's been research to show environmental exposure causes problems. So being aware of those kinds of environmental practices or factors would also be important.
And an elderly person sort of undergoing this degenerative disease is still subjected to some bit of stigma, meaning when they are in a social setting, people look at them differently. How do we, as society around, how do we accept and how do we help this person lead a more normal life?
Absolutely. I can't agree enough. There's so much stigma around conditions such as dementia. I have my former postdoctoral fellow did a fantastic series of work highlighting and documenting the stigma that we see in the system. And furthermore, she's gone on to develop interventions and opportunities, resources. For example, she's created awareness kind of approaches, action-related things as to what can people with dementia or people who are caring for people with dementia can do. And so there's a number of opportunities there in terms of learning about these diseases. Given the rates that we see, it's possibly coming near your own circle of influence. It's a relative, it's a friend, and so becoming aware is an incredibly important first step.
It's, I've had first-hand experience of some of those, and I think it's a life-changing experience to be around somebody with dementia or even early-stage dementia, leave alone advanced Alzheimer-like condition. Clearly, to tackle this breadth of elder care, say, propositions or elder care situations, the set of skills needed. I mean, you have the patient-facing, an elder care nurse or a physician. That's just a very small army. We talked earlier about big data. We talked earlier about how public health systems are now increasingly built using data. Help us understand that prospect with some examples, and possibly what could an AI engineer do in this space of healthcare and public health systems largely?
So a number of cool ideas are emerging from the field when the fields are talking to each other. So one project that we've been beginning to work on, we've submitted an application, is to look at social isolation in seniors with the AI platform that services seniors in rural communities. So it is using social network as a theory of computer science into human application. That's one example. We have researchers who are identifying advanced molecular compounds that can then become part of medication that addresses a condition. So we have analytical chemists in our own university who is sort of doing molecular diagnostics using AI. So there's a number of interfaces that can be created from people pursuing research. And I think globally as well we have opportunity. Canada is about 40 million people, but India is much, much larger and has incredible diversity. When countries can come together, the solutions that we can bring about from thoughtful understanding of the issue, systems alignment or support that we need to provide in place is incredible if we can begin to work together on complex issues like this.
We talked of elder care in a very broad context. The business of elder care is a massive business, and but it has not changed that much in the last several decades. Now with AI, big data, and possibly robotics, help us understand your view of where this field is going to be, 5-10 years from now. What are some ideas that are being experimented with?
Mm-hmm. There are a number of novel ideas that are being experimented with in terms of providing seniors care. In countries where the population has been aging very rapidly, robotics and technological transformation has been a lot more faster. For example, when you look at Japan as a country, the population has been aging for a significant period of time. You have the percentage of seniors over 80 is incredibly high compared to the youth population of the country. So they've been experimenting on robotics for seniors care in seniors' home. Long-term cares have deployed robotic technology to provide support, even conversation support. AI is coming in a big way to use technological platforms for various issues, diagnostic to intervention. I believe that we will be, as we move forward, it needs both. We will have technological advancement of doing amazing potential things that we were never able to do, but that human connection matters to that extent possible. So speaking to your grandparents or supporting your net of kin is really important. And for students who are involved in that area, you have one-on-one opportunity to be a fitness trainer, not training youth, but a seniors focus. You could have group kind of work. You can specialize and work with seniors as a group context or a population system context. So these are going to be concurrently happening into the next future. I think technology is not going to replace the entirety of human touch and human interface we need to have in seniors care, and both will have to coexist.
And the army of people that are needed to run this industry has to be growing, because in some sense the many countries that have aged quite a bit, where is this army of trained elder caregivers today coming from? I mean, where are they getting trained?
Training is so important, training and education, and we don't have as many programs that focus on seniors' health or gerontology. Even if you look at medicine as a specialty, geriatrics medicine is one of the least subscribed medicine branch. But when you look at the population numbers, the number of seniors growing is exponential. So again, there's a huge need for high quality education and training opportunity that can start at the undergraduate level. It could also be in the form of embedded certificate or certificates people can do. And so those are things that are offered in colleges and universities in Canada. As a University of Windsor is aspiring to be age-friendly university. That means that we will have a group of researchers who are all committed to research focusing on that area, that our programming is sensitive to age-related needs in terms of either curriculums in that area or courses related to aging and health. And so it's important for universities to think about training opportunity for training the next generation. But it's also not one and done. The field knowledge from 20 years ago has evolved. So there is a need for continuous learning opportunity in terms of innovation that come in the senior care field, and to have the opportunity to learn again and again as the field moves forward.
Only to be more neuroplastic than ever before. And policy, the role of governments and policy in this space, again, that's been one of your areas of research and expertise. Is the healthcare system and the healthcare policy of governments, say in Canada, US, or anywhere else, or globally, are they truly addressing elder care needs, or are there lacunae that you think we should be working with the governments more closely?
Absolutely, we need to be working with the governments more closely. We need good data and evidence to inform those policies. I find that there's considerable gaps in policy. For example, when we talk about India as a context, there's a number of long-term care kind of setup that is emerging, just given the need. If you look at Kerala, number of children who are outside of the country with aging parents in long-term care is high. But we don't have a regulatory framework, we don't have quality assurance, and we don't have sound policy that would then provide good, optimal care for seniors. So that will take many partners to work together. Researchers are one group. We need to work with not-for-profit and charitable groups that are advocating for seniors' health and welfare. They do have a role to play. Government sector have a role to play. And together, we can make improvements in terms of the policy framework that we have for providing care. That's one. The second I find is also we don't focus so much on health. We focus on care. So if we focus on health a lot more, the care needs diminishes, particularly around health care. So encouraging healthy behaviors from the outset, or incentivizing those kinds of policy framework of health promotions locally and globally would be important to minimize healthcare costs. That is costly and honestly needs much more work as well.
Sure. In fact, I was joking last night with a doctor, a friend of mine over dinner, that I'm willing to pay a doctor to keep me healthy. And when I become diseased, he has to pay me. So that's in my mind seemed to be the model we should have. In some sense, to keep the whole population healthy is a priority. And the healthcare system itself, let's take India, for example, right? As you alluded to the Kerala example, and it's right here and now starkly in our face example. There are two directions a system can go. We create an increasingly professionalized elder care system, or create systems that rely more on the immediate social network and strengthen that social network. And you, like the rural example you're talking about, what is an optimal solution? The completely professionalized version doesn't sound like is a good solution, but the purely socialized, social network dependent solution also has its problems.
Absolutely. And it's not either or, it is both. We need professional services, right? People are getting education and training to be doctors, right? It's not a service everybody can provide. You have trained geriatricians who specialize on aging and aging-related diseases. So you need that vertical of professional training and education expertise. On the other hand, it is also really important to provide support and capacities for families to look after families. And that's really an important, because that's the first line of health when you think about it. And so providing support for caregivers, for example, in terms of training and education opportunity for caregivers would be an important consideration to think about. And so we need a whole spectrum. The aging is such a large issue that it will not be just one sector. It needs the approach of both families and kin network as well. Some don't have families, and so they rely on the friendship and kin network of support through churches or temples and other social network and systems we have. So we need to think about it much more broadly than a vertical.
Okay, let's switch gears and talk sports. And you said you started this conversation with talking about how you were a passionate athlete. The world of kinesiology is extremely closely intertwined with performance athletics and performance athletes. Help us understand that space. What can a kinesiologist do? What does a kinesiologist do in the world of professional athletes?
Now, many of the professional teams have kinesiologists and personal trainers who assist them get ready for a competition. If it's sort of an individual sport, they work with the trainers to gain the capacity they need to shine. If it's a team sport, they have a team of professionals who are supporting. So it continues to play an incredibly important role. And I can also tell you how advanced the field has come. Research shows that female athletes, female basketball players, have a higher rates of anterior cruciate ligament tear. And that may be related to a number of different factors. It could be anatomy of how our body is structured. It could be how we are trained, how our muscles are trained. And I'm learning that now research has shown that the proportionality of muscle strength from your upper body to a lower body, proportionality matters. And so the kinesiologists working with, for example, female athletes can coach on the balance of muscle and training that is needed to optimize disease injury prevention. So those are some of the field optimization that are helpful. Of course, performance enhancement as well.
So this is an example of where there was work done in a lab to understand the effect of that ratio, so to say. And you've translated that all the way to where now a group of women athletes are benefiting from this balanced muscle tone and strength, I presume. So the biomechanics aspect also helps in both injury prevention and rehabilitation. And what is that space like for an athlete? How does one use the science of kinesiology in injury recovery from injury?
Biomechanics is really engineering of human body, and study that helps you understand how your body system can be a lot more efficient. So by training your body to be a lot more efficient, to go faster, jump higher, and do it in a safe way. That's one big arc of how that can be done. The second big layering of biomechanics is with injuries that are related to amputation, for example, working with prosthetics. That is also a big emerging field in Special Olympics, for example. How do the athletes continue to perform to the highest level keeping the body as efficient as possible through those assistive devices they need.
Let's come back to your own personal story of how you started as a student in Chennai, right? And so you're now in Windsor. What would be? I mean, you've talked of multiple opportunities that came your way that helped you engineer your career in different directions. What would be career advice that you would give to a young person starting out somewhere here in Chennai or somewhere in India or even somewhere in the world with an interest in human science? As to where could you start, and what are the breadth of opportunities that are beginning to open up?
Mm-hmm, absolutely. Starting small is important, right? The first step needs to be a strong step. So if you're pursuing your undergraduate, let's say in nutrition, or now you have degrees in exercise sciences as well, learn and have a strong foundation to build on. That's number one. That's really important, as I've talked about. The second is look for opportunities that exist. Don't have to be constrained to what is locally available. The world is your oyster. There's internet opportunities through open learning. Those are some considerations that you can pursue. In terms of careers, again, as I've sort of talked about, you have background career opportunities in sports sciences and performance, health science and health system sector, corporate world. And so again, it provides pathway for multiple lanes that you can go on and to create your own future.
And we are increasingly seeing students wanting to try out ideas for startups. India is the third largest startup market globally, and we are increasingly seeing the emergence of ideas. Help our audience understand what are some directions in which new startups seem to be emerging in this broader context of both public health and geriatric, elder care.
Mm-hmm. There's entrepreneurship has been very important for the future, to test out new ideas, to have opportunity for new ventures, for example, and so on. University of Windsor has a program called Venture U Boot Camp, and we use 1 week of the spring break and train students to take ideation, an idea, and you put them in different groups to, at the end, have a pitch that they can make. And so the successful pitch has been able to get some dollars to take it to the next level. So having those kinds of opportunities are important in an educational institution. I'm not sure what kind of venture U type of opportunities exist within high schools, for example, or colleges. So that is an area to explore. Within the public health and kinesiology area, there's a number of ventures such as your own private practice, for example, customizing to whether you want to pursue for seniors' health or whether you want to pursue for athletes. Those are sort of traditional ways. There's also app-based development. That's a big trend. You can do, if you look at your apps even, there's a number of apps you can use to keep your own accountability for your own fitness gain. So that's an emerging field, a number of apps that support health behavior, including physical activity and nutrition. Now you have scanned app that allows you to see how much of calories have you consumed, right? So that provides a bit more. So that technological related innovation will continue to see. I also would be a strong believer in social entrepreneurship and innovation, right? Where students with ideas can support seniors through a business enterprise that they can do. Could be social engagement kind of opportunity, reading for a group of seniors, if you will, and creating an opportunity through social innovation and engagement would be another important consideration for the future as well.
So everything from being, let's say, a single person, kinesiologist, biomechanics, elder care professional, to being, trying to engineer social care systems are all fair game for startup opportunities. And I think that's a pretty broad canvas to have in some sense. Not to mention AI and data science and how that can change the way elder care is going to be delivered. The last thought I have to bounce off you, yoga. India has a very long and active tradition of consuming and of manifesting yoga for many different situations. What has your experience been in Canada and in other places globally?
Wonderful. Even as a student living in Chennai, we did yoga as part of our physical education classes. So it's got a long-standing relationship. And now there's been a lot of research as well to show yoga and those practices are incredibly helping to increase balance in seniors, flexibility, and that then can help with, coming back to my research, support functional capacity and preventing falls. So it's a subgroup of practices that people can pursue. And so yoga has been shown to be beneficial. I know India celebrates yoga through World Yoga Day, and those are recognitions to create awareness. So it's not just seen as an India or Indian approach, that's a global approach.
It is indeed become a global approach. And I think there are many ways of tailoring yoga for different people's needs. And again, there are careers that are extremely rewarding. If you are a trained yoga professional, you could really make a good life for yourself and for the society at large. Your closing thoughts on what you want to tell our young, discerning student audience wanting to learn. Here, go deep before deciding.
So I would say to them, be curious in the field of choice, delve deeply into the area that you choose and work hard and get the support of the environment. Your friends, family are there to support you. The institution, the podcasts such as the one that is being framed today is another resource to give you that confidence to pursue your own dream.
That was a fascinating conversation on a range of topics from kinesiology, biomechanics, elder care, public health, and many related topics and careers that are emerging in those spaces with Professor Shanthi Johnson, who is the Vice President for Research and Innovation at the University of Windsor and a researcher in kinesiology for several decades now. The fascinating conversation threw up many options for careers that I'm sure you will all learn about and make informed career choices as you all move on in your own lives and careers. This podcast is brought to you by IITM Global from the Office of Global Engagement and is enabled by a whole range of stakeholders that support the creation and production of this podcast. You will find links in the description to all of those, that ecosystem that is helping produce this podcast. This is the Professor MVP podcast. I am Mahesh signing off. Namaskar.